everyone, and welcome back to the Chemist Couple podcast with your hosts Jess and Lee. We are both clinical pharmacists who work in GP practices in the northwest of England. The aim of our podcast is to provide evidence-based advice, personal experiences and create awareness around long-term health conditions. We hope you enjoy the show. Okay, so this week we are going to be discussing stress. It's been something that we've touched upon in a lot of the podcasts, and we've been saying for a while that we're going to do stress because actually it affects a lot of people, and everybody will experience stress at some point in their life, so we thought that is important as a topic to go through.
Yeah, and when we did ask if anyone wanted a podcast, that was the one that come up the most.
Yeah, it was.
But when we've been talking and doing the research on it, stress is interchangeably used with anxiety. And both of them don't go hand in hand as they should, or people think that they do. So we looked into the definition of what stress is and what anxiety is.
Yeah.
So stress is where there is an identifiable threat. Now, that could be a change in temperature, it could be a psychological threat, it could be trauma, emotional, infection. So there is something there, so your body is preparing in response to that, whereas anxiety is perceived threat, and that's where a lot of people use it wrongly, in my point of view anyway.
Yeah. So going back to that, where you were saying about what stress is compared to anxiety, so a stress response is something that we've adapted over thousands of years. So our ancestors will have experienced these stress responses just like we do today. And if you think about stress, I know that whenever we were in university and whenever I speak to other people, or whenever you hear people talking about stress, they always go to define it as this fight or flight response. And I'm sure people will have heard of that, meaning that it was a response that was formed because our ancestors, like we say, thousands of years ago,
were evading predators.
Yeah.
But so it was a like genetic system that was already in place to respond to what we've just said, trauma, infection and all these other things, like environmental extremes.
Yeah, so I think there was a podcast that we were listening to a couple of weeks ago where it was with Andrew Huberman wearing it, and he was saying a stress back then could have been something as simple as, not simple, but something like a family member going away from the tribe for a prolonged period of time. Obviously back then they didn't have phones, so you didn't know when the member was going to come back, whether they were even going to come back, and so your body was under stress because of that, like you say, extreme temperatures. So yeah, so it is a response that is always occurring, and it has always occurred for...
And we always look at it negatively. Like you've just said then, the body has evolved this process to treat and respond to all these environments. Stress is actually there for life. If we don't have a stress response, we would die after, depending on the hormones involved, it could be as little as 2 weeks.
Yeah, and so it's inherent to our survival.
Yeah.
It's so important to actually being able to survive.
But before we go into the physiology of it, I wanted to go through some stats.
Okay.
So you just said then from years ago it could have been someone leaving the tribe. Mm-hmm. There was the stats that come out where you were 4 times more likely now to say you've experienced or been overwhelmed due to stress than the older generation who are still around today. Mm-hmm. So that's one thing that we wanted to touch upon, because that's mainly, in my opinion, due to social media. The pace of life that we live at the moment, everything is such a fast pace. There's no, if you're not doing something, you fear of missing out on all these events and activities that are going on.
Yeah, and I think that's correct. And I think there was another stat which said that 73% of people said that it was related to work as well. And I feel like with the introduction of social media, I think we see the best and we see the worst of society. So constantly on a day-to-day basis, you can see people living this really high-end luxury life. And then on the other hand, you see people who are within war zones, like experiencing the worst possible things any human could experience. And we're constantly being like bombarded with absolute like contrasts and, things.
Yeah, there's information you wouldn't have had access to 50 years ago. Yeah,
and I feel like, touching upon the work thing, I feel that because of social media, people kind of strive to live this life of, like we say, that people are living on the higher end of society, and unfortunately most jobs just in general will not be able to provide that kind of lifestyle, and so I think that's where people kind of lose the love for whatever they're doing rather than doing a job that they love because they enjoy doing it. It's more about the money side of things, I think, in this day and age, because you're comparing yourself to all of these people on social media.
Yeah, I mean, if you look at everything in life, the cost of living's going up anyway. So, I mean, we were looking at family holidays. We haven't got a family, by the way, but Disney trips, for example. So I used to go on them when I was younger. The inflation rates of Disney trips have gone up. I think we priced the hotel that we stayed in when I was 10. I think it was 28 grand now for 2 weeks.
Yeah, it's just insane.
How's the average person going to afford a £28,000 hotel for 2 weeks?
Yeah.
That's something we used to do, fortunate enough to do quite a lot when I was younger. And that's the whole thing of social media. It is just a snapshot of this perfection.
Yeah, and obviously, a human nature, you do want to show the best side of yourself to other people, and so whatever you are seeing, like you say, is just a snapshot of people's lives. And I think, although we do know that, it's very difficult to see past it, and so I think you do just think, oh, you know, that person is living this incredible life, and actually, you know, there's other things that will be going on in life, and we do need to remember that.
But then if you take something away from this, and that is not a threat, so we shouldn't have a stress response or anxiety in this case towards that environment or that scenario, because it's not of threat to our health at that point in time. So this is where we just need to learn to control, put things into perspective and go forward.
Yeah.
Another stat, I think 1 in 3 people claimed it was due to relationships.
Yeah.
And another one was over 8 billion of hospital admission. Well, over 8 billion in terms of cost was related to stress-related health conditions, etc. So it is a big burden on society.
Yeah, it is. And there was also a stat that said that half of people who experience the stress will eat unhealthy because of it, or drink alcohol, which we will touch upon.
We are going to touch upon.
Which is possibly the worst thing that you could do, because it's kind of just, you're basically in a cycle.
Yeah.
Then if you're doing unhealthy habits and doing unhealthy things, then it will then further increase your levels of stress. So it's about trying to use ways and utilise things to be able to get out of that cycle.
Yeah. So should we go into physiology?
Yeah, I mean, we can touch a little bit
just
on
to touch a bit, just so people know the background of it. Like we said, it's your nervous system initiating this response. The one that we're going to touch upon, or the main part of this system, is cortisol. Now, the idea is that it mobilizes energy stores. Basically, it will break down proteins, fats, it will make more glucose, it prepares the body for, you know,
like an incoming threat, like you say, to be able to run away from a predator if that was what the threat was.
Yeah, and it also induces a state of anti-inflammation.
Yeah.
Where it was counterproductive or counterintuitive to what I thought, because if, let's say, you had a traumatic injury, you do want inflammation there to get the right cells there to build it back up, etc. But when you look at conditions such as rheumatoid arthritis and general trauma, the actual inflammation long term is what's the problem. So if you can dampen that down.
Yeah, and I think also what we've learned by researching this podcast is that stress is actually part of the homeostatic nature of your body. So we've discussed it in previous podcasts that it's this positive versus negative, and basically being able to balance it. So I looking at the pathway of stress, it does actually increase cytokines, which are like immune response like cells, which will increase inflammation, and then cortisol does decrease inflammation. So it's this play between the positive and the negative.
Yeah,
so
it's
that
always
could
a
be
yin and yang.
Yeah.
But we do use it. Everyone is aware of cortisol rising in the morning, first thing, and that's to prepare the body for the rest of the day. It should decline throughout the rest of the day, enabling you to go to sleep at night.
Yeah.
But then if we overactivate this system too much, then it leads to people having insomnia, and then that's when people get perceived stress. So when we're going to go into treatments, how you assess stress and anxiety in terms of good outcomes, a lot of it is going to be your perception.
Yeah.
Because like we said before, the weather today is raining. I could enjoy it.
Yeah.
So I could love going out there. So my stress and anxiety is fine. But you could hate it.
Yeah.
And then yours is through the roof. You have a different response. So it's all about how you perceive the threat and the benefit from it. But also you can use cortisol as something called a surrogate marker Whereas we know cortisol rises in stressful situations. If you monitor it and it comes down, then you know there is a positive response in that way. But do you want to go into treatment?
Or the physiology, we didn't really, or
What?
did you want to go more into that in terms of, no?
I don't know. We were going to go that from the other podcast we were listening to, and our one in particular, I think we go too much into physiology, and we are bringing out a podcast next week, because it is going to weekly, about the rebranding.
Yeah.
The idea that we are going to give more practical advice as opposed to the physiological, scientific. We're going to give that to support why we're giving the advice, but...
Yeah, okay, that's fine, yeah. So
I got told off by you last time, behind the scenes, because I go into it a bit too much.
Yeah.
And people probably tune out, if I'm being honest.
Okay then, well yeah, so we can go into treatment then. So as far as treatment goes, there's two different treatment options. So the non-pharmacological route, which means that it's, you know, natural things other than medication, or the pharmacological route, which would be to be commenced on medication, usually by your GP.
Yeah.
So non-pharmacological, so there's a few different things that we looked into and the studies of. So the first one was CBT, which is cognitive behavioural therapy. So at the moment, this is actually the first line of treatment that we would use within the NHS. So if you were to go to your GP and you were diagnosed with chronic stress, is what the condition really is, then CBT would be the first thing that we would offer. So CBT is basically talking therapies sort of thing, isn't it? Where it will try to put a positive spin on the anxieties that you're feeling or the stresses that you're feeling. So it will either they do like exposure to the actual fear is one of the ways that they use CBT. It will encourage you to engage in activities that make you feel more happy. So if there's something that you enjoy, such as maybe cooking, knitting, stuff like that, then they will encourage you to do more of the things that you like or that you enjoy.
And then re-challenge your thoughts. Because we were talking the other day in terms of, if you were brought up in a different household, different city, different country, your perceptions on what a threat was and all these other things would be changed.
Yeah.
So it's just about reprogramming your brain in essence.
Yeah.
And one thing I wanted to say is the treatment that we are touching upon now is how society perceives stress. So they see it as more anxiety. Mm-hmm. We're not doing it from a stress point of view in terms of you've got high cortisol, or Addison's disease, which is low cortisol, or Cushing's syndrome. We're not doing it from that point of view. We're doing it more from a psychological point of view, aren't we?
Yeah.
Because, I'll touch upon that later, but they are completely different.
Yeah. So with CBT, the studies suggested that on average, 60% of people did actually find a benefit with CBT. Now, we did look into the actual uptake of it and who completed it. So I think it's usually about a 7-week, or you do 7, I think it was in the study, it was people who completed the course had done 7 sessions, and I think it was over like 3-month period. And I think it was only about half of the people, or it might have been even a third of people who had been enrolled onto the actual course completed it. And with a 50% success rate, really, you would hope that it would be uptaken more.
But that's our experience anyway in the GP practice. Not many people like to take it up.
Yeah.
I'm probably one of the worst people for this. If I was a patient, talking therapy doesn't seem on the front of it and the face of it to be that effective, but it is. It's all about reprogramming your brain, but it's
I always remember saying that you said to me when we first met actually, and you said a problem shared is a problem halved, and I always remember you saying that. Yeah. And I think it is true. Like, and I think one of the things as well that we've looked into, or one of the things that you might think about when dealing with stress, is actually speaking to other people. So speaking to trusted family members. If you've got something that's playing on your mind, then, like you say, a problem shared is a problem halved, and you can get help from other people in that way, by sharing the issues and not letting the issue get too much. This is something that I do all of the time, and we just discussed this before we started the podcast. My personal experience with stress is that I'm one of these people who, for whatever reason, I will put off something. If I find something is going to cause me some kind of stress or some kind of uncomfortable feeling, whether it could be like an assignment that I need to do for university or whatever, I tend to put it off. And actually, instead of making the situation any better, it makes it 1,000 times worse. So then when I actually come to doing it, I've then only got a short amount of time to do it, and then my stress levels are through the roof. And so it's been something that throughout my life I've had to try and work upon, setting myself smaller targets, because it just becomes so overwhelming for me that then I'm in a state of where I can't do anything because I'm too overwhelmed by it. So yeah,
it's a snowball effect,
it
isn't
is literally. And so it's by identifying the issue at the very beginning, putting it down into small, things that you can work upon over a longer period of time. It will help, and then also like asking others for help.
Yeah, I mean CBT just is it's based on the principle of re-challenging your perception. That's what it is. Like you just said, then if you look at it in a different way, you don't look at the assignment as the whole thing and look at it as 10 different subjects that you need to complete. It breaks it down. It's a lot easier, and it is effective. I think it is one of the most effective forms of therapy.
It was the one that produced the most reduction in overall stress and anxiety in the studies.
But it is a long-term game and goal, isn't it, in terms of these therapies? You're not going to have one conversation. I mean, you could have a lot of benefit from one conversation, but it's more than likely going to take you a long time to change your perception, because if you think about it, you've developed these views and opinions and habits over years.
It is, and there was a study that actually said that your perception and how you deal with stress happens, or it's developed in like your early years. So actually it goes back to being in the womb. So it's so like how your neurons and everything are wired, it goes back to development in the fetal like stages of your life, and then it's nurtured more obviously when you're in your younger years, from how your parents or your grandparents or your siblings deal with stresses. So obviously, like you say, it's something that's happened over a long period of time. It's not just going to automatically resolve after one session although it could help.
Yeah. I mean, one thing that can happen quickly is what we listened to on the Huberman podcast, which is the breathing techniques.
Yeah, so that was the next thing that we were going to go on to, in the treatment of stress.
Yeah. And this has not a funny story, but we went to the chiropractor the other month because I had like a bit of a pain in my back, and the way I sit, especially after the gym, I do. If you're watching it on YouTube, you'll see that I'm trying actively to stay a bit straighter, but I had a bit of pain, which was due to an inflamed rib, tight rhomboids, etc. And he was saying that if you actually look at the breathing technique, that's what can lead to inflamed ribs, because we do a lot of chest breathing, which is not something that we're naturally meant to do. We're meant to do belly breathing, which if you look at children, neonates, toddlers, you will always see they've got a bigger belly, and the belly is very pronounced when they are breathing. And that actually has a link to quite a lot of evidence. And I think it's called diaphragmatic breathing, which is basically you are using your belly solely, and it enables the diaphragm to depress a bit more, which then apparently will stimulate the vagus nerve, which is involved in the sympathetic and parasympathetic nervous system balance. And it will lower heart rate, etc., and create this sense of calm. And the idea is, if you lower your breathing rate, you lower your heart rate, it then creates this idea that you're not breathless. Yeah.
We probably should try and find maybe a YouTube video of how to do the diaphragmatic breathing technique, and maybe link it in the bottom of the description.
I have been trying it.
Yeah.
It is weird.
It is.
But the reason why we stopped, are you going to go into this now?
was
more of an aesthetic point of view. If you're in public and you're dressed nicely, especially women, and they don't want to show the stomach, and they're like, it's hard.
I found it really fascinating, to be honest, when he did say it, because I always think, so my sister's, I've got a niece, and she's come up to 3 now, and I've just got the image that I have of her running around in a nappy, and it purely is just diaphragmatic breathing. The evidence for that was actually that it reduced stress by 35%. So whereas CBT was about 50 to 65%, this was 35%. But if you think about how easy it is to actually incorporate that into your technique of overcoming stress, it's pretty good, isn't it?
And if you go to any yoga, which we are going to go on to, a lot of these practices, the reason why they focus on breathing is it's one of the most present things you can do because subconsciously you do breathe, but when you actually draw attention to your breath, you then can't not focus on it, and it's hard. So if you are present with your breath, it then removes this outer perception of these perceived threats that aren't there. But deep breathing did have an efficacy of 30%.
Yeah, it did.
Just
So
wasn't
was
as good as the deep diaphragmatic breathing. But the one that Huberman said as a quick technique was to inhale deeply as much as you can through your nose, and then when you feel as though you can't breathe in anymore, take a quick sharp inhale through the nose and then slowly out through your mouth. And that's been apparently proven to show stress levels reduced in the quickest form, basically. Interesting.
Yeah, so the next thing then, like you said before, yoga.
Something that you're really good at, something you've taken a lot of time to look into and practice. I
feel like it's been something that I've done as well, unfortunately not really for the reason of trying to reduce stress or anxiety, but it was more because I had a back, like an injury with, not an injury, but I suffered with sciatica. But I found as well, over the past year, we've been preparing for a wedding, haven't we? Which, if anyone's gone through it, you'll know that it's one of the most stressful things that you can do in this day and age. Alongside that, we were actually we renovating a whole house, weren't we? Again, another thing that is really stressful. So we've actually had a really stressful, I'd say like 18 months. And the way that I've dealt with it has been the gym. So we've been fortunate enough to build a gym in the house, haven't we? So since then, I've been going to the gym almost every day. And maybe not doing a really intense session, but I was doing weightlifting probably about 4 times a week. We were doing a little bit of running. So yeah, last year we were doing more of that. Whereas I found actually when you do look at the studies into exercise, some of that type of exercise can actually increase your cortisol levels. So although we know a little bit of cortisol and a little bit of stress is good for us, probably that type of workouts and exercise that I was doing wasn't beneficial to my stress, although it did take my mind off things for the time whilst being in like doing the exercise. It probably wasn't the best. And so actually another interesting thing that we found out from the chiropractor was that whenever he gets people being referred with a flare-up of sciatica or something like that, it's usually when people are going on holiday or they're going through something stressful, which correlates to actually that it could be being caused by stress. So if we go back to April when my sciatica did flare up, we were going on holiday. We just cancelled the wedding, which we just due to things like family and just general like things getting on top of us, wasn't it? We ended up cancelling the wedding, and my sciatica at that point flared up, which could have been due to stress. And then I obviously started practicing yoga almost every day, because I feel like, again, that type of exercise, you can do it every day because you're not really overdoing it.
I don't know. From my point of view, it's hard. But the hardest form of exercise for me.
Yeah, but it allows you, I feel, to do it because it's more relaxed and it's more focusing on technique. It's being...
What was I going to say then? It's having intent with your movement.
Yeah. But yeah, I feel like it's allowed me to do it every day. And so I feel now less stressed than I ever have, because yoga is one of the ways that you would do it. But yeah, like you say, it's the breathing techniques that you do within yoga, the fact that I'm able to do it almost every day and practice it almost every day. Also, when you do yoga, they tend to have positive affirmations when you're doing it, which I always find good. We have the Peloton app, which if anyone is looking for an app that they want to get for exercises or anything like that, Peloton is a really good app. So you don't have to have the Peloton bike or the tread or the row now. They have like on-demand classes, so they do strength classes, they do yoga, they do Pilates, and then they also do meditation on there, don't they? So I would actually recommend anyone downloading that and like subscribing to it. But yeah, so I just practice that for 30 minutes every day, and it has helped with my stress levels.
And the results back it up, I think. So with yoga, it's about perceived levels of stress and anxiety, and it comes to 40% of people who undertook yoga did feel that they'd reduced it greatly. And this was only 2 to 3 times a week, by the way, for 30 to 60 minutes. Mm-hmm. So if anyone does want to start yoga and feel like they want to get the benefits for the maximum maximum output with the limited input, it would be 2 to 3 times a week, 30 to 60 minutes doing yoga. There's a lot on YouTube if you don't want to pay for the app.
Yeah.
I mean,
there's so many videos out there that you can get for free.
Yeah, all you need is a yoga mat.
Yeah.
I would get yoga blocks if you're not that flexible. So they're essential for you. You don't really need them. And then you can get a towel because sometimes you need to, like I'm trying now, to stay upright when you're sitting down. But yeah, that's all you need. And it is beneficial.
And, I mean, we've been practicing it as humans for thousands of years. So, yeah, I mean, I really have fallen in love with yoga. I do love it.
Which is good.
Yeah.
And then you're going to go into ice baths?
No, so I was going to say then exercise can also have a big reduction on anxiety, just general.
Yeah,
so
the release of endorphins. Yeah. Everyone knows that if they are into exercise anyway.
I think there's a saying, isn't there, that you'll never regret a workout, and there is an actual scientific reason for that, is because when you do exercise or you do a workout, it does release endorphins, and so you'll never come out regretting a workout.
No, and you can always feel this sense of accomplishment if you do something you don't want to do. That's with anything in life as well.
Yeah. And then the last thing, just before we go on to ice baths and things, is nature. So there were studies on that, wasn't there, where even if you looked at a picture of nature, it could reduce your stress levels. Going for a walk, obviously, is incorporating exercise with being out in nature.
Removing, I think that's more down to the fact that you're not watching a telly as well. You are occupying your brain with something else.
Yeah.
But yeah, even just looking at pictures of nature reduce your stress levels and anxiety. We've heard it before that that might be the reason why it's on Apple and Microsoft. There's like screensavers potentially.
Interesting.
It is.
That's what that was.
And then ice baths, we looked into this because if anything, it would be classed as a stressful situation.
Yeah.
Which is ironic if you wanted to relieve stress. But the reasons why people do ice baths are different. So if you look at it from a recovery point of view, if you're a high-end athlete and you're doing intense exercise, you don't want that muscle inflamed, because if you do, you're not exercising tomorrow at the same level.
Yeah.
So it does reduce it due to the effects of cortisol, etc. And heat as well. If you do cold exposure, it shunts the blood away from that muscle into the central capacity of your body.
Yeah.
But from a stress point of view, it will improve stress resilience. So if you expose yourself to something, again, that's in CBT, exposing yourself to your threat. If you do it enough within a controlled environment, you will become better. Whether that's transferable, we didn't find any studies on being transferable to another aspect of life. So if you can control cold exposure, is that good within a fight or within a presentation? I don't know.
Yeah. But if you think about it as well, when you do an ice bath, it forces you to have controlled breathing. So that's the way that you can get through it. So if you've been in it for a couple of minutes, you breathe to reduce your heart rate, to reduce your stress level. So it's also like practicing the breathing techniques as well.
Yeah.
Isn't
I mean, at first you do breathe.
Yeah.
But the idea is to try and slow it down, as you said.
Yeah. So do you want to go into a little bit about the long-term health, the long-term consequences of chronic stress? So
it's up to you. Or do you want to go into pharmacological treatment?
Oh yeah, we could do. Yeah, so we've done the non-pharm.
So that's what you should ideally be doing if you do feel overwhelmed. We're going to say stress in this point as anxiety, really. We're not using it in the other literal sense. But the main thing that happens is that patients get put on medication. Now, you will find a lot of patients get put on beta blockers for anxiety with physical related symptoms such as high heart rate, sweating, for example. The idea is the beta blocker controls your heart rate and then it brings you down to like this zen. Yeah,
so the beta blocker works on beta receptors, which are part of your autonomic nervous system, and so they will do the opposite of what a stressful situation does. So it's, like you say, reduces your heart rate. It's supposed to reduce your respiratory rate. So important thing to note about beta blockers is that if you do have asthma, it can cause constriction of your airways. So it used to be cautioned, but now it is contraindicated if you're using it for if it's a non-selective beta blocker like Propanal.
Is it contraindicated anyway for any, even selective ones?
So when it was, and then I went on to on our system what we use, EMIS. If anyone is a pharmacist will know probably what that means. It's a working in primary care. it comes up now that if you absolutely have to use it, so for instance, if a patient has had a heart attack, so this is not for anxiety, but if you're using it for something
like cardiological,
like cardiovascular reasons, then you assess the risk versus the benefit, and then you would use a cardio-selective one. So that means that the medication just works on the beta receptors in your heart rather than all over your body, which would mean that it would work in your lungs. So that's what it's saying now. But yeah, with it for anxiety, we shouldn't be using it anymore, and that's because it's been related to some deaths where a patient was taking a beta blocker and they had an asthma attack and died. And
I think it's actually been in general in terms of with the effects on your heart rate, it depresses it too much. So they're taken, because if you ever dose Propanal, that's the main beta blocker for anyone who's taken it or is within the medical space anyway. Propanol is the beta blocker of choice. It's non-selective, meaning it does have the affinity for both lungs, heart, etc. And the doses can be really high. So you can have 40 milligrams 3 times a day. Now, if your blood pressure and heart rate are normally okay, if you're having high doses of beta blocker because it's as required, it's how you feel.
Sorry, I know what you mean. So you're saying because there was an MHRA one.
That's the one I meant.
Where there was overdoses on it.
There's been numerous overdoses, and it's due to the fact that it does lower blood pressure and heart rate so significantly that any overdose will lead to
death. So that's usually what we tend to see. First line, I would say it's not
acute. It's more
acute, for treatment of like an acute stress response.
Only if you've got them physical symptoms.
That's what it's supposed to be, isn't it?
Supposed to be, but it's just used generically now.
Yeah, I would say so.
And then going on to what should be used, more of a long-term therapy, it should be diagnosed based on what your diagnosis is. Now, there are numerous types of anxiety. There's generalized anxiety disorder, PTSD, OCD. You've got situational anxiety, seasonal affective disorder. You've got all these different types, and the licenses for these medications that we're going to mention change depending on what type you've been diagnosed with. But generally, first line for anxiety is an SSRI, which is a selective serotonin reuptake inhibitor. And they include sertraline, citalopram, paroxetine, etc. And I mean, they are effective. A lot of people think you're going to see an effect from day one. You're not. It's normally going to take 2 to 4 weeks. You have to stay on them for a prolonged period of time to prevent rebound symptoms, etc. But you were going to go through some of the cautions. Yeah,
I mean, so with all SSRIs in that class, they do increase your bleeding risk, mainly GI, so your gastrointestinal tract bleeding, so stomach bleeds. Something to bear in mind that if you've had a history of like an ulcer, if you are over the age of 65, you're going to increase your risk of bleeding in those situations anyway. So sometimes we will give patients something like lansoprazole or omeprazole to take alongside it, just to protect the stomach lining. If you're taking citalopram, you can get QT prolongation with it. So QT prolongation is something to do with your heart. So you've got your heart beats to a specific wave.
Everyone know we're on an ECG.
Yeah, on an ECG.
It's the last.
Yeah, so it's the last little part. So if you increase your QT, it can cause different things, such as like torsades to points and things like that. So if you've got an underlying heart condition or an established heart condition and you've been put on citalopram, it's just something to bear in mind. It doesn't mean that you can't have it. It just means that there might be more monitoring that we need to put in place. Like Lee said, you should remain on it for 6 months at least, and that's just to prevent a relapse. So if you are started on SSRI, you may feel, like you say, after 4 weeks, I feel better. I feel like I could come off it, but it's what you shouldn't, because like you say, you could get the relapse, and then if you actually get a relapse and get put back on it, it means that you have to stay on it then for at least a year. Again, just something to bear in mind. If you're going to be stopping an SSRI as well, or any antidepressant, sometimes you'll need a gradual dose reduction, and that's just to to reduce either the side effects or withdrawal effects, and then also rebound. So speak to your doctor about it. We did discuss about pregnancy and breastfeeding, didn't we? So
yeah, it's that one would be in conjunction with a clinic or a specialist GP, and the idea is that there have been links to not so much malformations, but problems within pregnancy. But if the patient is going to self-harm or do something detrimental to their health that was mentally, you're best giving them a medication. And sertraline, then medications are more, well, they're better studied and it's safer.
And then, go on.
I was going to say citalopram.
The biggest,
is that what you're going to say?
Go on, you said
No, go on.
No, go on.
So the MHRA, so they're the ones who issue a lot of the advice and alerts on medication. If you are taking citalopram and you are over the age of 65, you have to have it reduced. So it's 20 milligrams for citalopram, and for escitalopram it's 10 milligrams because of this risk of QT prolongation. And if you prolong that interval between the Q and T, it then allows all these arrhythmias to come in. A lot of people are unaware of it. A lot of healthcare professionals are unaware of it. And then ideally what happens is you can go on to another SSRI. You can go to sertraline. So, you know,
if the lower dose isn't effective.
Yeah, and like you said before, you should do this carefully with a GP, pharmacist, etc. There are guidelines up there where you wouldn't just straight swap. Well, you can, depend on your dose, but normally there's a cross-tapering regime, and that's something you need to be wary of.
Yeah, just to be aware of that. Sometimes, you can't just stop taking these medications, or if you start on another one, it needs to be cross-tapered.
But yeah, that's the main bulk of it. I mean, you can go on to pregabalin and all these other medications. We're not going to.
No, so I mean, just to touch upon it, the second line, if you didn't tolerate an SSRI, then it would be an SNRI, which they work in a similar way, but they're involved also with noradrenaline. Yeah. So an example of one of them would be duloxetine. That can also be used as well for like
stress incontinence, diabetic neuropathy.
Yeah, but it's all to do with the fact that it's working on your central nervous system. And then third line is actually pregabalin, which was first used for epileptic patients. Again, it works on your central nervous system, and so that's how it exerts its effects. But the important thing to note about that is that it is now a controlled medication, which means that it is a medication that has been abused.
Is that the same for all the other? I know that's for general anxiety disorder. I don't know for the other disorders whether pregablin's next, but
I think it was. I don't know, actually. It might have just been. I think it is only generalised, because I think that's the only licensing that it has got for that, isn't it?
And a lot of other medication that are used temporarily, and it's normally in bereavement or other things. It's diazepam. That's a big one, and it's only licensed for short-term use because of its addictive properties. It does have a poor side effect profile, but a lot of people will use equivalents such as midazolam before they go into operating theatres. They'll have it for dental procedures. Some people have it before they go on flights. And it does work, and they are beneficial in that way. But in terms of why we use it, why we shouldn't use it in anxiety, is we should get down to the root cause of it, because otherwise it's just going to mask your symptoms. You're going to become dependent on it, and going forward it can lead to respiratory depression. It's not a nice thing to be on. No. And it's an awkward one because it is prescribed quite a bit. And I think it's to appease the patient, as opposed to actually helping them and say, well, it's only going to mask it for the next week. Yeah, because the way that it works is like to basically dampen down your it works similar to how alcohol works. It's on the same pathway, but it just doesn't have the hangover effect, which is why a lot of people like to misuse it. Yeah, that's probably a good time to touch upon the fact that a lot of people who do suffer with stress and anxiety will self-medicate with alcohol. And like we say, although alcohol in the short term will dampen down your immune system so that you don't feel as much emotion, the next day your body is then in a heightened environment of feeling stressed. I mean, you've probably heard of the term drown your sorrows. It would drown your sorrows, yeah, but also like what was I thinking, where you get a hangover or anxiety, like, and then never heard that. Where the next day you feel real anxiety, and that's because when you've had alcohol, you've dampened down all these GABA receptors so that your immune system's being, and then as soon as the alcohol's taken away, the system then is over heightened, and you can feel them really anxious. So again, it's not just like in your mind, it is actually a physiological response. And so, alcohol's possibly the worst thing that you could be treating it with, although it is the thing that we do historically try and treat it with. I mean, I think you've got some stats on it. We said before, 30% of people on average do self-medicate with alcohol.
If
The
40% was what we... I
Was
think,
that on
yeah.
the NHS digital?
Yeah.
But the problem's still there. That's the whole point. That's the ironic thing of it. You drink to obviously become, mainly it's drunk, isn't it? That's the idea of
Yeah.
it, to relax yourself, become unaware of this environment. That's what lowers your stress level, because you're unaware to your surroundings. But then the next day, like you said, you wake up, the problem's still there. Ironically, you've worsened the situation because your health's declined acutely. You've wasted a lot more money because it's not cheap. And then you could have ruined some relationships because you've said things that you shouldn't have said when you're not aware of the complications of what you've said, basically.
Yeah.
Ironically, it's the worst thing you can do. But as a culture, as society, we have always done that.
Yeah.
If something traumatic comes about, have a whiskey. And you watch on films, they've always got a lovely bottle of whiskey in these high-end directors' boxes, haven't they?
Yeah.
Does nothing.
No.
It's not what you should do.
No.
Same with food. We're going to go to comfort eating as well. So 49% or 46% said that they comfort eat too much or eat the wrong food. We will touch upon, I think, diet and other therapies of anxiety in another podcast, because it's to do with tryptophan and all these, how your gut microbiome can influence these chemicals, etc. But this idea that something's gone on that's terrible, or you can't deal with a certain scenario, to then replace that with something that you do like to do.
Yeah.
So eat.
Yeah. So in the acute stress response, so if you are, if it's like something that you say where you happen to run away from a stressor or whatever, it does decrease your appetite, and so it is involved in the pathways in your brain that will decrease that. However, chronic stress or chronic anxiety will actually, your body craves like carbohydrates because of this physiological response that's going on, and then once you actually have it, it sends signals to your brain that make you feel good, and so you then get into the cycle of having these things to make yourself feel better, and so it's difficult then to get out of it. And again, people think that it's just like, oh, it's a comfort blanket, but it actually physiologically does make you feel better, and so that response then it's like a reward, and so it increases dopamine and things like that, so you will tend to choose unhealthier foods. And then, like you say, if you are choosing more unhealthier foods that have got less fibre in them, then you're feeding your gut microbiome less. It means that you're not being able to absorb things like tryptophan, which is a precursor to serotonin. Yeah. And so again, it's just a vicious cycle. It's a cycle. Yeah.
It is. And then that also leads to a lack of physical activity. We've explained the benefits. So ironically, how we deal with these situations is the opposite to how we should treat them.
Yeah, it is.
What else is there that we were going to go through?
I feel like there was maybe risk factors of long-term health like.
Yeah, so we've talked about dependence on these. So you can have poor diet, alcoholism, drug misuse again. So all these can lead to all different things. It can affect your relationship. We know the health consequences of such things. Other long-term complications.
So cardiovascular health. So when you have a stress response, like we mentioned before, it increases your blood pressure. Yeah. It also increases inflammation, which can then, it causes like endothelial dysfunction. So it can increase your risk of developing things like hypercholesterolemia. It also it puts your body into this metabolic syndrome as well. It increases obesity. It increases visceral adiposity, which means that it's increasing the fat around your central organs, which, like we have discussed in the obesity podcast, is the worst type of fat that you can possibly...
That's quite hard to understand, isn't it?
It is.
In terms of cortisol. So, as you know, cortisol does break down fat, it breaks down protein. So you would expect someone who's stressed to be very thin. But in Cushing's syndrome, you'll get moon face appearance, you'll get a lot of fat around the trunk, and it's because it's able to mobilise fats from different areas to then, it's like a balancing act then with where it deposits it. It's quite hard to, it's a complex system really.
It is, yeah.
To get your head around.
Yeah, then it also has effects on your immune system. So increased cortisol increases anti-inflammatory effects, which dampens down your immune system. So anybody who's on long-term steroids will know that they usually have to carry a card around with them because it can cause immunosuppression. Meaning that you're more susceptible to developing, bacterial infections, viral infections. It also has a massive effect on reproductive health, which is actually another podcast that we're going to discuss because it's something that our listeners have actually asked for us to discuss. So if you're if you are have chronic stress, then you've got a 30% higher chance of irregular menstrual cycles and a 20% reduction in conceiving. So I know a few people at the moment who are trying to conceive, but I feel like it's this. You've probably heard like these stories a lot where, because you're trying to conceive and it's all consuming, you don't get pregnant because you're in a constant state of stress. And then as soon as you stop thinking about it and say, right, okay, I've like resigned to the fact that it might not be like something that's for me, then you get pregnant, you know. And you've heard of people who've gone through IVF, it hasn't happened for them, and then they've just resigned to the fact, okay, it's not going to happen, and then all of a sudden they get pregnant, and it's probably due to this stressful environment.
They're all interlinked, aren't they, in terms of diet, physical activity, stress. They affect so many different systems within the body.
And then I think the last thing is just maybe who is at higher risk of developing chronic stress. So females, twice as common.
Yeah.
Whether that's to do with the fact that females are more likely to actually report it, we don't know.
I think more so. I think if you ask a lot of men out there who are in relationships, they'll say they're more stressed with what the women do in their family.
Yeah. But family history, so if you've got a parent, a grandparent, a sibling who has been diagnosed with chronic stress or anxiety,
is that genetic or nurture?
Well, that's what I mean. So I think childhood adversity is also is a risk factor, and then also socio-economic environment. And again, it's maybe to do with,
it's all that social media that we said at the beginning. If you're living a below par life in the eyes of social media, then it's only going to affect you negatively, isn't it?
But yeah, I think we've probably touched upon quite a bit in this podcast. It's been sort of like an overview of stress, and like, the main thing that we wanted you to take from this podcast would be to utilize maybe some of the things that we've mentioned on how to best deal with stress. Like I mentioned, for me personally, I think trying to deal with it as soon as you get the stressor. So as soon as you've been put in a stressful situation, whether it's you've got an assignment coming up, you're having to talk at an event, I don't know, it's dealing with it head on, utilizing like yoga, meditation, breathing techniques. If it gets too much and you feel like you need other help, then CBT is a very good way to deal with that. And then obviously there's the pharmacological therapies that you would get from your GP. There are things that you can buy over the counter, which I'm not going to touch too much upon because we don't really advocate for them, but it's things like St. John's wort would be something that a lot of people do take.
Yeah, a lot of people do herbal products. St. John's wort, anyone who's in pharmacy and health in general, it interacts and interferes with absolutely everything.
Yeah. You
pain. It's one thing that you taught about in uni. But herbal products, a lot of people say, I'm taking this. Herbal products aren't regulated to the same extent and level as pharmacological agents. We are going to do a podcast on herbal products and licensing, how they register, because what they say is on the box and milligrams, etc., could be something completely different.
Yeah,
it's not. How do you put it? It's not tested to the same level. And that's because to bring a drug to market, it's on average 3 billion. That's what I got used to get quoted when I was in university. £3 billion to bring a drug to market.
It's crazy.
It's a lot of money.
Yeah.
But yeah, I think take away the practical advice we've given. This is how we're going to do more podcasts in the future. Give it more to do with the practical outcomes as opposed to, we're going to touch on physiology, going to touch on medication. Ideally in this situation, the natural process is the best because it's something we can adapt to. The pharmacological are beneficial, but like we've said, take Propanal, you can constrict your airways and have breathlessness, which ironically increase your anxiety, get SSRIs or other medication. You can get heart defects, you can get gastrointestinal bleeds. They've got other problems associated with them, and I'm not against using them, but try and utilize all the other methods first and don't turn your nose up at them because they are effective. Yeah,
and I think also just recognizing that it is a natural response. So like having stress is something that we need in order to be able to survive, and so kind of embrace the stresses of life, but just don't let it overtake your life. And like
it should be turned on acutely and then switched off. That's the whole point of stress, isn't it?
Yeah.
And I'm not going to touch upon it in detail, but if you go for surgery and you've got a problem with your stress hormones in terms of they're too low, you'll be given an extra shot of cortisol, because if you don't, you won't be able to deal with the response and the trauma of surgery. You won't be able to deal with that as a stress, and it's got such a high mortality rate in terms of having low cortisol within your body. I think it's from 8% mortality, probably even higher. I'll let you close because you started on the intro.
But yeah, so thank you everybody for listening to this podcast. We hope that you enjoyed it. The next podcast that we're going to do is going to be talking more about where the direction of our podcast is going. You'll notice that people who've listened to it from the beginning, that we have actually done a rebrand, so we have changed our name. But yeah, we will be discussing that in the next one. And as always, if you have any questions, then message us on either YouTube now, because this will be going off as a video, as well as also the podcast on Spotify.
Thanks for listening. We're going to bring it out next week. We're going to bring this out on Monday, and then it's going to be weekly going on from there. So thanks for listening.